There's nothing more enjoyable, especially for a guy, than going to a doctor's office. It's pleasant, it's relaxing, it's quick, it's convenient. That's why we go all the time. This doctor's trying to change all that. Prashant Krishnan.
Krishnan, yes.
You're a doctor of what?
I'm a gastroenterologist with Peak Gastroenterology Associates.
How long have you been doing it?
I graduated in 2009 and started working here right after training.
You're doing something a little different, and it's hard to get my mind around. You call it patient-centered care. But basically, you think that going to a hospital is not necessarily or always the right choice instead of going to a specialist or what's the best way to call it, a boutique shop?
Well, so I think the big difference is whether you want something done at a hospital versus whether you want something done at an outpatient center, whether it's a clinic, whether it's an outpatient surgery center. And so there are differences. There are things each of them do well, and
a lot of things you go to the hospital for are outpatient services.
That's correct.
A colonoscopy or what is it? The other end. What's
upper endoscopy, an EGD.
Oh, it's so pleasant. All right, but you go in, you get that done, and it's just as fun as being in the hospital. But they don't give you a bed. Is that why would doing it at an outpatient facility be preferred?
So it really depends on what we're doing and why we're doing it. There are some things that really require hospitalization, and there are other things that can be done in an outpatient center. As to why it's preferred to be done in an outpatient center, we are highly focused. So we're doing nothing but gastroenterology, whereas the hospital has to take care of a whole bunch of other stuff, cardiology, oncology, surgery. And so because of that focus, we're able to get you in, we're able to get you out probably within 1 to 1.5 hours max. And so our registration is fast. We get the patients checked in.
Right. That sounds like a nice advertisement, but really, what did you do differently than what a hospital does? If I come into your shop, and every 10 years I need that colonoscopy, and oh, what a fun day that is. What would I notice different? What is absolutely different?
Efficiency. Efficiency is the main thing. Customer service is going to be something else, because this is all we do. All we do is gastroenterology, day in, day out, 24/7. And so that's our focus, and we do it extremely well. We don't have to worry about catering to other types of medical specialties like oncology, surgery. The surgeons will take care of that. The oncologists will take care of that. But in an outpatient model, especially in a private practice model, our focus is linear, which is gastroenterology.
Tell me before about what you did to the actual physical space of your office. What was that?
So we talk about patient-centered care all the time, and it really becomes meaningless unless you can actually demonstrate the patient is at the center of the care. And so one of the things that both myself and Dr. Patel, who's the founding partner of the practice, did was we sat down one day and we said, we don't want to deliver healthcare the way everybody else does, because we see a lot of inefficiencies. What we want to do is something called the You campaign that we came up with. And every decision that we made, we filtered it through the lens of you being the patient, and we did everything around them. So we bought a building, we gutted it out, we designed it around their experience. We wanted to make it so efficient because patients are already feeling lousy. They have
What's different about the physical space? I mean, I know you go to a doctor's office, you're in a waiting room, and then they call your name, and you go to another waiting room, which you actually think you're going to see the doctor, but you don't. You wait there, and you go, I wish I brought the magazine, and then maybe he comes in whenever.
Yeah, so that's the typical experience. You won't see that at our facility. So one of the things we designed around is how many steps does it take for the patient to get from the front door to our front desk? And we wanted to minimize that.
Really, the actual steps to the reception desk?
Yes, and then even after the reception desk to the exam room, and then from the exam room back out. And the reason why that's important is they already have a busy day. They've planned out their day, and they're feeling lousy. They're coming here because they're feeling lousy. We don't want it to be an excursion. We want it to just be a small detour in their regular day. And so that's what we did. We even went through the process of checking patients in. I went and gave my insurance card to my front desk, and they said, what do you want me to do? And I said, check me in the same way you would anyone else. And so when I did that the first time, I was in and out in an hour and 15 minutes. I said, this is completely unacceptable. And so we ran this drill 2 more times. New patients, even though they're filling out all that paperwork, from the time their feet walk into the building to the time they walk out, 45 minutes or less. Established patients, 30 minutes or less. If the patients show up on time, we will make sure they are seen at their scheduled time.
Hold it. Time out a second. Time out a second. That makes no sense, because while the rest of us work on a clock, doctors work in a whole different universe. And so you go to a doctor, and I understand another patient comes in and it's an emergency, and they got to take care of this, or they get somebody who's really sick comes in, they need some help, but it messes up the entire day, and it's as if doctors' offices don't realize, no, I'm the customer here.
Yes.
But I'm not the customer here. The insurance company is the customer here.
And that's unfortunate. That's the moral hazard of having someone right in between the two people that are actually involved in the health care process, which is the patient and the provider. And so one of the things that we've done to circumvent that is our practice has grown. We were at 4 just 4.5 years ago. We're at 23. When most practices struggle to maintain status quo, we've almost gone up by 5 to 6 times.
It sounds like a much more expensive facility. I mean, it sounds costly. Why would I go there?
There's no cost that's passed on to the customer, to the patient. In fact, the whole goal here is to change the way healthcare is delivered so that the focus is on you.
It costs more. There's no way that having a schedule that's tight and having that type of service doesn't cost more. You're not making as much money.
That's right. So that's what happens. Where we decided to focus is we're willing to cut our margins down a little bit to make sure the patients get the experience that they deserve.
You think you make that money back?
I think what will probably happen is when patients start to see this type of experience and then they go talk to their friends, they go talk to their family members, patients that may not have come to our practice before now decided to do so, so the volume starts to pick up. And I think that's one of the ways we've been able to successfully expand from 4 to 23 in less than 4.5 years, which is unheard of.
How would a patient know about this? Listen, you go to your physician, and they take your blood, and then you got to wait, and then you see him again, and then they say, it's been you're at the age now, it's time to get a colonoscopy, and you go, okay, and then you're kind of up there. They can have a suggestion, but it usually just brings you right back to the hospital. How do people know about this? And your business is specialized.
Yes.
Can you see that in other areas as well?
Yes. Everyone has the capacity to do this, but overall healthcare does not run like a service industry, which I think it should. And so even though all practices have the capacity to do this, their focus is different. And so I think what we really have to do is put the patient first. And when people start to do that, you start to get innovative, you start to get creative. And that creativity, that innovation, I think is lacking in healthcare, and that's what I think we need.
Where does it not work? I mean, where can you see this not working? Can that model actually happen at a general practitioner's office?
Yes.
How? I've never known one to do that. And they've got all sorts of different things. What keeps a doctor from being on time?
So there are several things that people don't see when you're at a doctor's office. And so there are a lot of regulations that we have to abide by. And the more regulations that start to kick in, it starts to slow us down. Because when you have to make a phone call that really should not be in the realm of the physician, that takes away time from actual clinical care. When you're starting to fill out authorization forms for insurance companies, we didn't go to school to do that. We went to school to take care of you and your family members. And that's where our passion is. That's where we want to be. And so with excess regulations, it takes us away from what we've been trained to do.
We've got about a half a minute. Would you also say that doctors might be great doctors, but they're lousy businessmen? I mean, it's a whole different thing. The guy who opens up the Orange Julius might know something more about customer service and how to serve your customer more than a doctor.
I would completely echo that sentiment, and it's sad to say that, but I think that we could turn that around because doctors really do care. That's why we went into this profession in the first place.
I'm pretty sure they went into the profession to look at a screen instead of the patient while you're doing this stuff now. Hey, people want to go or check out your service, where do they go?
To our website, peakgastro.com, and I would love to get any feedback.
Doctor, thank you very much. Listen for me at KHOW Radio, read me in the Denver Post, check out the Independence Institute, and we'll see you next week.